My name is Dr. Adams, and I'm an ophthalmologist in Albuquerque. I wanted to make a video about what appears to be an increasing number of people presenting to my office with mask neurosis. And I do not want to say that I'm against masks for the pandemic. I actually made one of my first videos last April in 2020 about the benefits of masks. I disagreed intensely with the CDC and other thought individuals who claimed in February of 2020 that masks would do no good for COVID-19. I felt that they were making a political calculation that if they told people to wear masks, there would be a run on masks and there wouldn't be enough availability for medical facilities. But obviously, if they're beneficial for medical facilities, they're beneficial for everyone. Now, that having been said, the studies that have been done in the last year on COVID-19 relating to masks have kind of been equivocal. There was a Danish study that really indicated no benefit, etc. I personally believe, however, that there was a benefit, and it wasn't necessarily a benefit due to reducing COVID-19 spread. There was a distinct benefit in reducing the spread of other respiratory viruses. There have been a number of studies for many years that have indicated that viruses such as adenovirus and influenza are reduced, or the spread of viruses like adenovirus and influenza. Adenovirus causes common colds, influenza obviously causes the influenza, can be mitigated with mask use, and that masks block the large particles that tend to spread these diseases. And we appear to have had an extremely mild influenza season this past year. Having talked to, since I'm a pediatric specialist, I talked to a lot of pediatricians, and the pediatricians have all told me that they really have had almost no respiratory viruses. They haven't had the common cold coming in. They haven't had respiratory syncytial virus. They haven't had a significant amount of adenovirus or influenza. So it appears that the social distancing and masking that has been done for the past year has dramatically reduced the spread of other respiratory viruses and have possibly helped with COVID. It's really unclear. That having been said, I have advocated since last fall that our policymakers seem to be losing sight of the goal of the exercise. The entire goal of the exercise, the entire goal of wearing masks, of social distancing, of reducing our economic output, which has had lots of other effects. I've had patients commit suicide. I've had friends commit suicide. I have seen people with significant economic stress. I've seen a range of things that have occurred because of those lockdowns, which were certainly not beneficial to society. But the whole goal of the exercise was to prevent our ICUs and hospitals from being overwhelmed. And we largely achieved that in the United States. There were certain periods of time, late December, last spring, where there was a lot of pressure on the hospitals and it appeared that they were becoming overwhelmed. I have friends who are ICU physicians, and they told me all sorts of stories about how busy it was and how intense it was. And by late February, my friends who are ICU physicians were telling me that actually the ICU admissions were down and it was getting close to the kind of volume that they were experiencing in a normal influenza season, which is very encouraging. Texas, in early March, decided to open up their economy and eliminate mask mandates. I personally, at the time, thought they were probably premature with their decision. Now that it's May 7th, I was wrong. I said this in late November, early December, that the whole goal of the exercise was to take the stress off of the hospitals and the ICUs, and that once a vaccine was available, which in early December it was evidently on the horizon to be available in a very short period of time. Once that vaccine was available, we would need to vaccinate the 15 to 20% of the population that accounts for over 80% of the hospitalizations and ICU admissions. Those are very predictable population of people over the age of 65, people with diabetes, high blood pressure, obesity, history of cancer, other autoimmune problems. And once that percentage of the population was vaccinated, we would expect to see a significant drop in cases, a significant drop in hospitalizations, a significant drop in ICU admissions. And we actually started seeing that by mid to late February. By the time Texas decided to eliminate their mask mandates and open their economy, they had vaccinated approximately 11% of their population. And it appears in retrospect that they had vaccinated the correct 11% of their population because the rates continued to drop. There was not a significant spike once they opened their economy. And all the collateral damage that comes with depression from suicide, drug use, etc., seems to have stabilized in Texas as well, which is fabulous. I mean, it's good for all of humanity. I now am of the position, as of May 7th, that the whole country should have opened up once we hit about a 10 to 15% vaccination rate for the population. We're now well in excess of a 30% vaccination, and the continued use of masks is, frankly, at this point, ridiculous. Social distancing is no longer necessary, and no economic restrictions to businesses should be in place as of May 7th, 2021, in my opinion. At this point, the disease will still spread, and there will still be tragedies. I have a patient who's 16. He was hospitalized for months. The rest of his family had basically mild symptoms from COVID, but he was hospitalized for over a month. The child doesn't have pre-existing conditions. He's not obese. He doesn't have severe respiratory problems or anything else. He just got hit by a bolt of lightning, and he is still undergoing medical procedures. He might need a gastric tube in order to provide feeding because he has gastroparesis, or basically his intestines are no longer functioning properly. I mean, he has severe problems, and I recognize that these severe problems will happen, and they're tragic and depressing. But in reality, when you're talking about dealing with 330 million people, you also have to look at the significant impact of depression, drug use, loss of economic opportunity, and the potential deaths that may occur from that. And there have been some economic studies that estimate 800,000 or 900,000 deaths over the next decade due to our economic downturn, due to increased drug usage and suicide and other things. I commented on that extensively in my December video. The point being that we are now beyond that point, and there's absolutely no justification for continuing to shut down the society and to continuing to obsessively wear masks everywhere you go. I have lots of patients who are vaccinated. I've been vaccinated. Not only have I been vaccinated, but I actually had COVID in December. So I'm a COVID survivor, and I've had both of the Pfizer vaccines. So the statistical risk that I am carrying is, or spreading COVID, is less than 6%. If you have a patient who's also vaccinated and they have less than a 6%, you have a cumulative decrease in the risk so that it is vanishingly close to zero between two vaccinated people. And yet they obsessively come in with two masks on, with N95 masks, and if they're steaming up the phoropter, the machine back here, they almost feel anxious when I suggest that maybe they move their masks so that it doesn't steam up the phoropter, because frankly, there's no risk to them medically from COVID at this point, given the fact that I'm vaccinated, they're vaccinated, I'm wearing a mask, and frankly, neither of us need to be wearing masks at this point. I'm only doing it for social reasons because people feel more comfortable with me wearing a mask and because our state still mandates it in New Mexico. And that's the problem. The state should stop mandating it. We're at the point where enough of the population that is vulnerable to hospitalization has been vaccinated. We will still see cases of hospitalizations and we will still see fatalities because this disease is not going away. In fact, COVID is probably with us forever. It will probably mutate every year or every 2 years. We will probably need booster vaccines. And we're going to have to learn to live with this disease as a society. And I think that when people feel sick, I think that when people feel anxious about the environment they're going into, they should be welcome and encouraged to wear masks. I do not think that masks should be mandated to the general population because I do not think that at this point the benefits outweigh the social risks, and there's certainly no reason for children to be masked at school. Frankly, there's no reason for children to be masked at all. There's no reason for children to be masked at summer camp or in any other environment. Children shouldn't be masked, probably never should have been masked, because we've known since last April that kids really weren't major spreaders of this and weren't really strongly susceptible to this disease and were not really driving the spread of this disease, unlike other diseases. I mean, kids are generally the drivers of influenza and adenoviruses and the common cold and everything else. But in this case, it was an exception. So those are my thoughts on masks. Again, I support mask use when people feel ill. I support mask use when people feel uncomfortable. But I think that mandating them is no longer indicated based upon the numbers of vaccinated patients and the numbers of hospital and ICU admissions being significantly decreased over where they have been at any point since really last March of 2020. So those are my thoughts. Have a healthy and happy COVID season.